Now, what we're doing on EASD TV is we're trying to find you particularly interesting poster presentations. And I found one, and it's Christian Hansen, who's from Denmark. And what attracted me to your poster was that it was about a very complication of diabetes, autonomic neuropathy. Tell us a bit more about that and what you're doing in that area.
Yes, at Dino we're trying to have a bit more focus on neuropathy, both peripheral and autonomic neuropathy, because it is one of the complications that's been maybe overlooked for quite some decades. I mean, we're doing great advances in cardiovascular diseases, nephropathy, but neuropathy has maybe been overlooked for quite some time. And we're looking into both peripheral and autonomic neuropathy at Steno, trying to find reversible risk factors, try to learn more about the disease itself. And that's what we're focusing on here, and have had several posters here, especially looking into the young type 1 diabetes patients, where you might have a reversible states of neuropathy that might be reversed or even cured.
So the big question, first of all, is this to do with glycemic variability?
That's a very good question. I mean, glycemic variability has been a major focus for quite some years now, but we don't really have an exact link between glucose variability and complications later on in life. But we try to look into this young cohort of type 1 diabetes patients between 18 and 22 and looked into the glycemic variability and tried to assess if there was an association between glycemic variability and measures of autonomic and peripheral neuropathy.
And is there?
It doesn't seem that way. I mean,
which is a bit counterintuitive, isn't it? Because that is the dogma, that you have to have control, because otherwise you're going to develop all these horrible complications.
Yeah, exactly. And we know that both hypoglycemia and hyperglycemia are risk factors for neuropathy, but they have not really been established. I mean, having high glucose promotes oxidative stress and could potentially be a risk factor for neuropathy, but we're not able to see that at all in our patients, even though we had about 30 to 40% who had signs of neuropathy. They didn't have symptoms, but we could measure them with objective measures of neuropathy. So they have neuropathy at a very early age, but we couldn't find an association between glycemic variability and these measures.
Now, you talked about reversibility.
Exactly.
In what sense?
In the sense that there's been a great stride to try to cure neuropathy, but all studies have been negative. We find our patients, at least in our clinic, at very late stages of neuropathy, where they have symptoms, where they have gastroparesis, nausea, hypertension and pain. And for most of these stages, it's too late. You can't really do anything about it. You can treat the symptoms to some extent, but curing or reversing the neuropathy has not been shown to be possible in any studies.
But what about at an earlier stage? Can you reverse potentially?
Yes, if you catch the patients early enough, studies have shown both for autonomic neuropathy and peripheral neuropathy that they can be reversed, improving glycemic control and reducing cardiovascular risk factors. So, in a general sense, it's important to screen for neuropathy, to catch these patients at an early stage, to try to intervene before it's too late.
And what does your intervention consist of?
Well, we're looking into reversible risk factors. We're looking into vitamin D, for example, vitamin B12, which we have been able to associate with autonomic and autonomic neuropathy, and also both in type 1 and type 2 diabetes patients in the adult and in the adolescents as well. And we know that if we treat our patients with metformin, they can get low vitamin B12 serum concentrations. And that's a fairly easy, treatable and reversible state. So that we haven't done any interventional studies yet, but we're looking into doing that, seeing if we were able to prevent or improve measures of neuropathy by applying, for instance, vitamin B12 supplements or vitamin D supplements at early stages of neuropathy.
Very interesting. Thank you so much. Well, a very interesting, not just one poster, but several posters from this group. And you can find all the posters via the EASD.org site and on the virtual conference.